So we talk about thyroid gland. Thyroid gland is located attached to the trachea, below the larynx. Parathyroid glands, they are on the posterior surface of the thyroid gland. So thyroid gland, they make T3 and T4. T3 we call it triiodothyronine. It has 3 iodine atoms. So we call T3 and T4, in general, we call them thyroid hormone. So there are 2 types of thyroid hormone. First one is called T3 triiodothyronine because this thyroid hormone has 3 iodine atoms. This one, T4, it has 4 iodine atoms in here, and we call this thyroxine, or sometimes we call it tetraiodothyronine. 4 thyroxine, it has 4 iodine atoms. That's why a thyroid gland requires iodine to make the thyroid hormone. And then if we don't have enough iodine in our diet, then the thyroid gland cannot make this hormone, then will cause goiter. Both T3 and T4, the thyroid hormone in general, they can increase metabolic rate. They can tell the cell to metabolize glucose so that we can have more energy to use. Thyroid gland also produces something called calcitonin. Calcitonin is it regulates calcium. What does it mean? It increases the blood calcium level. It increases blood calcium level. It also tells the bone to uptake more calcium. That means it helps the bone to mineralize. It helps the mineralization of the bone. Calcium is important in many aspects other than bone. Muscle contraction, nerve conduction, or I'll say the action potential, and also the blood clotting. And I want to emphasize this point. The reuptake or mineralization of the bone calcitonin becomes one treatment method of osteoporosis. So yeah, calcitonin becomes a form of treatment of osteoporosis. Parathyroid hormone. The parathyroid gland makes parathyroid hormone. The main function of PTH is to increase the calcium level in the blood. When our body have a low calcium level, then the parathyroid gland can detect it and then secrete PTH. The PTH will increase the activity of osteoclasts, and osteoclasts will dissolve the bone to release more calcium in the blood, and then it will also increase the PTH, the parathyroid hormone, will also increase the reabsorption of calcium by the kidney, so that telling the kidney, to tell the kidney to secrete less, to excrete or secrete less calcium in the urine, so that we can retain more calcium in the bone. It also activates the vitamin D, so that it will enhance the absorption of calcium in the GI tract. When blood calcium level increases, then a PTH will stop secreting. So this is the homeostatic cycle. When we have low blood calcium level, then the parathyroid gland will release PTH and the PTH will tell the bone to release more calcium, dissolving the bone, and also tell the kidney to activate more vitamin D so that the GI tract can absorb more calcium. So that these two function in conjunction hopefully it can raise the calcium level back to the homeostatic level. On the other hand, when we have too high calcium level, then the thyroid gland will stop the secretion. The thyroid gland will start to secrete calcitonin in the blood, and the calcitonin in the blood will tell the bone to mineralize. That means to absorb more calcium, to build more bone, to store more bone in order to lower the calcium level to restore the homeostasis. So you can see that calcitonin and PTH, they are also antagonistic hormone. They have, meaning they have opposite effect. Calcitonin lower calcium level in the blood, but parathyroid hormone raises the calcium level in the blood. Okay, for adrenal gland is very it is on top of the kidneys, of course. Adrenal gland has two parts, medulla and cortex. Cortex is the outer portion, medulla is the inner portion. The adrenal medulla is under the control of the nervous system, especially the autonomic nervous system. Adrenal cortex, on the other hand, under the control of ACTH, adrenocorticotropic hormone. Adrenal, meaning that it is work on adrenal gland. Which part of the adrenal gland? Cortex. So this ACTH is secreted by anterior pituitary. And the hypothalamus, what does it do? It has innervation through the sympathetic nerve to go to the adrenal medulla. So the preganglionic sympathetic neuron will innervate the adrenal medulla. The adrenal medulla can secrete epinephrine and norepinephrine. Adrenaline and noradrenaline, if you are British. For American, we call this epinephrine and norepinephrine. These two, they're both hormones, and also they can be neurotransmitter. But since in this case we are saying that it is adrenal medulla secreting epinephrine and norepinephrine, so it is a form of a hormone. And then these bring rapid short-term changes. So we use adrenaline and noradrenaline for fight or flight responses. Which is a sympathetic response. They are sympathetic responses. Adrenal cortex, on the other hand, is for long-term changes. Adrenal cortex secretes two types of hormone, glucocorticoid and mineralocorticoid. Glucocorticoid are mainly to increase the glucose level in our body to deal with stress. And the mineralocorticoid, it has something to do with regulating salt and water balances to maintain or to increase the blood volume and blood pressure. So this one, mineralocorticoid, we have talked about this in the urinary system. The one that we talk about is the aldosterone. And for glucocorticoid, we will talk about it, the example will be cortisol.